Hello and welcome everyone. Thank you for joining us for another episode on Aging Gracefully, a talk show for evergreens. The topic of discussion today will be the relationship of mental well-being and physical ailments and the impact of one over the other. We welcome our audience for the participation of this discussion, and we take immense pleasure to welcome our esteemed panelists for today. Reverend Father Juventius Andrade, lovingly known as Father Juvie, needs no introduction at all. Father Juvie has been right through the journey with us in this series. A scripture professor from Rome, he served as a member of the General Council of the Redemptorists for 13 years and now continues his work in the province of Bangalore. A warm welcome, Father Juvie.
Thank you.
Dr. Angeliqueka Rao, she is a practicing psychiatrist in London. She is from Bangalore, where she received her medical degree and then moved on to London to practice psychiatry. A very warm welcome to you, Dr. Angeliqueka, and a warm welcome to all our audience this day. So tell us, Father Juvie, of all the episodes that we've done so far, how did you all come up with this idea and this theme?
Thank you for that question, but before that, let me say what a privilege it is to be once again in the midst of all of you, and welcome Darryl for you first time as the host, and of course it's nice to see a familiar face, Angelica, with us as well. I think we cannot stress enough that health is not just physical health alone, although they have wonderful parameters and ways of assessing that. Because health, holistically considered, is the body, the mind, and I would insist, the spirit as well. And when the three of them really come together, you could say you're really enjoying the best of health. You know, when God created both male and female in God's own image and likeness, Genesis chapter 1, and at the end of this whole creative process, God saw that it was very good. And so when we are in balance, in harmony, in all these three elements of the body and the mind and the spirit, you could say we are experiencing a serenity and a well-being that is not just compartmentalized. Because what we are really experiencing is a sense of being at home with ourselves, because when we are not at ease, we call it dis-ease. And so when we look at these aspects about life, especially in the context of this program that we are doing, Aging Gracefully, the talk show for evergreens, we are really trying to look at it from different aspects and different dimensions, holistically, so that we are better able, despite sometimes the ravages of age, sometimes the pain of illness, and then of course impending death, that we approach it with a certain serenity and being placid about it, simply knowing that we are in God's hands in this entire process. That's important for us to realize. Now, it is in this context that we've been looking at various dimensions, as you rightly highlighted in your question. And there will be some elements there where there will be some kind of a repetition or overlap. There's an old Latin saying, repetitio mater studiorum est, which means repetition is the mother of learning. And I don't mean repetition as merely rote or repetition. I mean that an acknowledged fact that is stated before, but in a new context gets a better meaning and a broader perspective. And so that's why we've been looking at different dimensions. Some of it might, as I said, find a sense of an overlap or running concurrently. Just to quickly take you through some of the recent episodes. So when we looked at episode 9 and 10, it was really about mental health among the elderly. And we had you, Angeliqueka Rao, at that moment for that, looking at different aspects about memory loss, about dementia and Alzheimer's, looked at that. This was followed up in episodes 11 and 12 on physical exercises for the elderly. Again, that enabled people to look particularly at the physical dimension and how that will help for an overall health, not just physically, but mentally, emotionally as well. And then when we looked at episode 13 onwards, we looked at the living will, which was really conversations about towards the end of life. So while they are all part of a piece, but they're also part of a bigger picture. And therefore, in approaching the theme that you highlighted at the very start, it's bringing all these together. Because at some stage of our life, a number of us are go through a particular kind of an illness, sometimes life-threatening, and it affects not only the body, it also impacts the mind. Well, I would say the reverse also is true.
Absolutely.
And to see this connection and to see how we can best respond is something I think that will certainly help this process. And as always, I must make a disclaimer. This is a talk show. Now, we have on this panel and through all these episodes, eminently qualified people, professional people, people in practice, and therefore they come with a wealth of experience. But this is for information. This is not medical diagnosis of any sort. It will open conversations that should make you say, aha, that's my story. Maybe this is saying something to me, and it's for you to pursue it with your medical practitioner so that you get specific advice to your specific condition. What we hope, as it's called a talk show, is that it enables the conversation to take place to talk about things that normally we might not think about talking, or even if we do think, we find it rather uncomfortable. And so when we do it in this process, it's something that will help us all and take this process so that all of us together will age gracefully. And I think it is in this context, I think I should leave the space open to the professional, because it's born out of your experience that you bring to the fore some of the things that will be helpful for all of us in this journey.
Thank you, Father Juvi. I think that was very well put, a great preamble. You're right in thinking that mind and body are very closely connected. So when there are issues with your physical health, it does have an impact on your mental health. Those who suffer with mental illness will also then progress to have various physical illnesses. So that's absolutely right. Considering that this is a talk show for people who are aging gracefully, we've focused our minds on certain conditions that are more common with the elderly because of their failing health, because of medication, because of social circumstances. And so we have a few chosen conditions that we are going to discuss today. And we are hoping to relate that to people's experiences and perhaps have a vignette where, people can then understand how things can become a little bit confused between physical health and mental health.
So, Dr. Angelica, based on the years of experience, what are some of the conditions that highlight this relationship between physical ailments and mental health?
Okay. Thank you. That's a good question, Darryl. Let's start with things that are more common with the elderly. So we've spoken about dementia, but there are some physical conditions that mimic dementia, like delirium. So delirium is a condition where a person can very quickly, very suddenly become confused, irritable, disorientated, and you're sitting there thinking, what's happening with my loved one? Why is this sudden deterioration? Because it mimics dementia with the disorientation, the memory loss, not being able to recognize people sometimes, not knowing where they are, it's easy for carers to believe that mom or dad or whoever it is becoming demented, becoming forgetful, and ignore the physical conditions that might be causing the sudden deterioration. Now, with delirium, you can have a hyperactive delirium where someone's really irritable, wandering, aggressive, or you can have a hypoactive, which is less active, where it's a very subtle, ongoing deterioration in their mental state. Now, delirium is usually caused by infections. So if there is an infection that hasn't come to light, there are no outstanding symptoms like a fever or a cough, but there is a brewing infection, you can get delirium. It could be because of medication. Some medications don't suit some patients. It could be post-operative. It could be because they're in a lot of pain. So as we get older, arthritis is very common, rheumatoid arthritis. It could be post-surgical, where you're still in pain even though you've recovered, you're rehabilitated. It could be a urinary tract infection which hasn't actually manifested itself yet. So there are various reasons why someone can present with delirium. Just for example, there was somebody a friend of a friend who said, would you mind coming in and having a chat with mum? Because sometimes she's so difficult. She's shouting, she's irritable, you can't talk to her, she doesn't want to eat, and yet at other times she's fine. And because we're human, we tend to relate it to, when my brother's around, she's really good, but when I'm taking care of her, she's really angry. Now that's coincidence. With delirium, it is actually up and down. So you can have periods of being absolutely cognitively present. You know where you are, you know what you're doing, you can talk about what's going on, but you can then have periods where you're really irritable and disorientated. So at that point, if it's a sudden onset, you need to seek medical attention straight away. Because it's very easy to ignore it and say it could be, the weather, it could be she ate something, or it could be because someone came and said something to her and irritated her. So it's really important at all times to have a second opinion from a doctor. Speak to a doctor, say that this is the changes we're noticing, what could it be? Because we quite often put everything into a dementia basket and say, well, mum's getting on with age, we should expect these times, we expect these moods. But in fact, no, it is something, if it's a sudden change or if it's gradual and out of character, then you must seek medical help, because it could be an underlying infection. And if that infection turns into sepsis, then we're talking about a life-limiting condition. So as much as a physical condition can mimic a mental health issue, always make sure that you see a doctor and you get an opinion. And blood tests are very important as well.
Very interesting, doctor. And what treatment would you suggest in cases of delirium?
Okay, so Darryl, before treatment, we need to assess what's going on with the patient. We need to find the source of infection or the source of the delirium. So it could be pain management, it could be antibiotics, it could be a fluid imbalance. There are various things that, will actually treat the delirium. And treat is a good word, because that's how you differentiate delirium from dementia. Dementia is an ongoing deterioration, whereas with a delirium, it's transient and fluctuating. So once you treat the cause of it, over a period of time, the delirium disappears and the person is back to who they were. Whereas with dementia, you manage the behaviors, but there is no actual cure. And that's a differentiation that carers' observations are so crucial. Because when you go to a doctor and you say, this is what mum's like in the morning, but then in the afternoon, she's like this, or it comes and goes, or it's a steady deterioration, that helps us as doctors kind of pin what the condition is, and then further tests, like I said, blood tests and various analysis will help with the treatment. So it's to find the etiology, find the reason of the delirium, and then treat that.
I can so much relate to this because my father-in-law is going through a very similar condition as we speak, and the caregivers said that dementia had set in. But as I hear you now, it's more of delirium than dementia, because there are times when he's perfectly normal, he'll have a normal conversation with you. He's lost mobility in both his legs, where one of his legs is infected and there is absolute pain, excruciating pain in that wound, and they have to dress it every day. And when he's having these normal conversations, there will be a sentence or two that he will fly past you, and he'll say, I went home the other day and popped by and saw everyone, and everyone was happy, and one would begin to realize that this is totally out of context. And I'm so happy to know that this is probably more delirium than what they told us initially.
Okay, so word of warning, if it's a continued confusion and disorientation, despite treatment, so pain management in his case, if the infection, it would be antibiotics.
Yes.
If he still has, episodes and phases where he's absolutely lucid and then he goes off on a tangent, you might be heading towards dementia more than delirium.
So there's a fine line.
There's a very fine, and to throw a fly in the ointment, people who have early onset of dementia, the earlier stages, they do have lucid periods. They do have lucid moments where, they can hold a conversation and they do remember. But then, the forgetfulness slips in. So it's about waiting and watching and treating. So once the infection is controlled, once the pain management is, what it should be, then you do a mental state examination, and then you see where he is and check his memory, check his orientation. So don't, just a word of warning.
True.
That they are so similar that you have to treat one to eliminate all of that, and then what you're left with is probably the diagnosis.
True. That's interesting, Dr. Angelica. Would there be other conditions that you'd like to throw light on?
Sure, Darryl. If we talk about electrolyte imbalance, because that's something that's commonly found amongst the elderly, largely due to medications they might be on. So if we think about sodium, think about potassium, think about calcium, these are called electrolytes because, in fact, the ions of each one of these have an electrical charge. And that electrical charge helps them to get into the cells of our body and help us function. So while if we think of calcium, for example, we think of bones and teeth straight away, but it has a much bigger role. So it helps with neurotransmission, it helps with muscle contraction and relaxation, and it also helps in the general well-being of your nervous system. So when you have too much calcium or too little calcium in your body, that is thrown out of gear. It helps regulate your heartbeat because the heart is a muscle. And for example, the fluid imbalance for elderly people or anybody who's on a diuretic. So we're talking about a medication that helps you eliminate fluid from your body because you are retaining fluid. That will cause immediately for your calcium, sodium, potassium levels to be depleted. Usually not enough for you to have any kind of severe illness. But if your doctor feels that your levels are low, they give you a potassium supplement, or they say eat a banana every day when you're on a diuretic. So the functioning of electrolytes in your system is very important. But again, when they're starting to be depleted, it can mimic mental illness. So someone who's got low sodium, for example, starts to feel lethargic, agitated, concentration is poor, very tired, appetite is not great, sleep disturbances. Now, all of this can be what someone experiences when they're depressed. So when you're watching someone go through this, you say, yeah, she's very down. She doesn't want to do anything. He's not getting up and going out like he used to do. He won't even go to mass with the family every Sunday. But it's important that you start thinking out of the box. Is this just because he's, moving on in age? Is it because of social circumstances? Is it because he's not taking his medication appropriately? So when elderly people live alone, they can forget to take medication. Yes. They might not take their supplements. Yes. And that accumulates. Hyponatremia, the low sodium in your blood, is very serious. It is a medical emergency. And it's something that should be taken seriously. So regular medical checkups. So if it's something that's gradual, insidious, as we call in onset, then medical checkups, blood tests, all of that has to be regular to keep the mind and body working in sync. So calcium, potassium, sodium, very, very important for cardiac functioning, fluid imbalance, muscles. Sometimes you might find elderly people of any age saying they have muscle cramps, and it can wake them up in the night because it's so severe. And at that point, again, a blood test, you need to make sure that you're on top of all the analysis so that that doesn't become a chronic problem. Again, diet, exercise, all of that helps. So that's a condition that elderly people are very prone to. Over 65s are very prone to because of the medication they're on.
I think Father Juvi, as Doctor was speaking about eons and the charges and the interactions, I couldn't help but think what an awesome creation we are.
Exactly. That's why I began with this whole element of balance in the body. It's so well calibrated that if you're out of sync with one, that's why I brought in physical, mental, but also of the spirit.
Absolutely.
Because if any of them is malnourished or malfunctioning, we experience this lack of harmony and a lack of ease. Thank you for spelling this out particularly because, in the pastoral circumstances, I do meet people with that. And sometimes it's important not just for the person who's undergoing the symptoms, but who might be so disoriented, but those around in the home and the family to keep an eye on, as you said, regular sort of monitoring or observation. Just like you use the word out of character. You say, oh, this is not something that we have so associated with the person, particularly if it is something so dramatic or overnight.
Yes. Actually, Father, there are other conditions like a gastrointestinal infection, so vomiting, diarrhea, that will deplete the electrolytes very quickly. So, we have various powders and things that you can get over at the chemist to say, mix it with water and keep drinking it, or, tender coconut or whatever. Those are really good. But there has to be a more general monitoring of it, especially in the elderly, because you can go downhill so quickly. It can lead to multi-organ failure. There are various things as sequelae of low electrolytes, so it needs to be taken quite seriously. Not panic, but take it seriously.
It's like, I suppose, the symptoms are like warning lights or flashing symbols say, the symptom is a cry for help, actually.
Yes, yes. And there are supplements to help. So people with ongoing renal failure, for example, or cardiac failure, there are supplements that you take to make sure that your electrolytes are in balance, because in renal failure, for example, your kidneys are never going to be able to filter out what you should keep and what you should get rid of. So that filtration process starts to deteriorate. So supplements are given to make sure that the electrolytes are as they should be.
And what is, I think, also equally important is for people at home, for the family members, to be alert and watchful, because assuming one symptom over the other,
yes,
thinking that it's a mood swing,
yes,
over actual depletion of
absolutely
parameters,
absolutely
could be a fatal mistake.
In an extreme case,
yes.
Yeah. And I think as much as we owe so much to the internet and the knowledge it brings, it's also quite frustrating for us medics when you present a case and you say, but I've Googled it and this is what it is. So, it can become a bit frustrating, because what you're doing then is you're preempting what the condition is, and therefore you might not take it that seriously. So
True.
It always comes with a disclaimer. Any internet website you go always has a disclaimer to please seek medical attention. So it's right. Don't assume. Don't take anything for granted. Yes. It could absolutely be a mental health deterioration, but always rule out a physical cause. And that's something we do as psychiatrists. When you have a first presentation, what we call, whatever the age is, we run a whole gamut of tests. So, we'll do a CT head, we do blood tests, we do various things just to make sure that we're not missing something basic that's physical because of the presentation being one of mental illness. I think this will resonate with Father Juvie. We say don't assume, because if you break the word down, it makes an ass of you and me.
I like the point, but not the connection. Thank you, Angelica, for leading us and navigating us through this theme that is so important, because you not only explained it to us, but you also clarified and tried to distinguish what mimics, what resembles certain symptoms, and as well as possible courses of response to something like that. And I think that's helpful. Because I want to bring up something that I came across in a pastoral situation. A rather elderly gentleman had, started losing a lot of weight, and to the point that even the eyes started bulging, and it took a long time to diagnose that. And then they finally called it hypothyroidism. I also learned that there's hypothyroidism. And since this is a condition, particularly the latter, that affects a lot of elderly people, perhaps you could throw some light on this condition.
Sure. So hyper and hypothyroidism, Father Juvie, are not particular to the elderly. You can have it in your early years as well. But the elderly are more prone to symptoms of these, and it can be lost, because let's take hypothyroidism to start with. So it means that your thyroid gland is not producing enough thyroxine for all the various functions that it's required for. So you start getting a kind of a drop in energy levels, concentration, mood swings, an apathetic kind of a presentation. You can put on a lot of weight, and you can. It also affects blood pressure from time to time. That your blood pressure can go up when your thyroid levels are low. So these are symptoms that the elderly are more prone to anyway. So the link between mental health and physical health here plays a part again, because you would imagine that as you're getting into your 70s, your 80s, you're going to be slowing down anyway. And so those symptoms can be very easily masked with other problems that you might be having, with social issues, isolation. You have to actually be able to consider other conditions before hanging your hat on a mental health issue. So yes, hypothyroidism is quite common, very easily treatable, and resolved very easily as well, which is a good thing. Conversely, you can have hyperthyroidism, which means your thyroid gland is overactive. So you're producing a lot more thyroxine than you need, which then can give you cardiac symptoms. So you get irregular heartbeat or palpitations. You get exophthalmos, was what you described, where the eyeballs become bulgy. You get you can have ataxia, where you're not steady on your feet. In extreme cases, you have tremors. You're constantly hungry. You're burning up a lot of energy because of the extra thyroxine. So you're eating but losing weight. And generally, you can be quite disoriented sometimes. So both, a lack of thyroxine and more thyroxine can both bring their own problems, and both can mimic, again, a mental health issue. So when you have hyperthyroidism, you have a mood disorder. So you can be quite elated and you can feel on edge all the time. So patients will describe like, I'm anxious, like something's going to happen. I don't know what it is, but something's going to happen. Or you can be euphoric. You can be, really very, very happy, and you think everything's so wonderful. Again, that mimics a bipolar disorder, the hypomania. So yes, you're right. Thyroid plays a very big part, and it's one of the major tests that we do on first presentation of mental health patients. We test for thyroid because either low or high functioning thyroid has very clear symptoms it's easy to misdiagnose.
In earlier times, they used to speak about goiter. Is that, what's the connection, or what's that?
Okay.
I don't hear that word too much these days.
So goiter is when you have an overactive thyroid. Sometimes your thyroid gland, which is at the base of your neck here, can become, when it's overactive, it becomes bigger than normal, and it can look like a bulge. And so that we call goiter. Yeah. Not used very much anymore, yes.
Thank you for elucidating and for enlightening us on something that affects so many people. But it's when you put a name and describe it, you say, that's something that I know, or something I've been going through. And that gives us a wake-up call to get it medically treated at your professional doctor. Thank you.
That was truly very interesting, Doctor. And the more Doctor spoke about the overlapping symptoms and the interacting of one atom with the other, I began to relate that of the saying, though we are many, we are one body. And so that one body interacts with each atom to make that wholesome body, And so that came to my mind. We've come to the end of part 1 of this episode on the relationship of physical ailments and mental well-being. We will continue our discussions in part 2. Until then, signing off from all of us at Aging Gracefully, a talk show for evergreens. Don't forget to like, share and subscribe to this channel. I'm sure that if you've loved this episode, your friends and family will love it too. I'm thinking of vitamin deficiencies, Doctor, something that we all go through at one stage or the other. And would you like to say something about that? A colleague of mine burst into a skin pigmentation, decolorization of the skin, and they said it was a deficiency, which he then underwent extensive period of treatment. He's thankfully the skin has returned back to normal. One predominant factor was that he would enter the office before sunrise and exit the office after sunset. And so we were wondering whether this correlated to exposure to the sun, now that you mentioned the long exposures to sun. So is there any correlation to this?
Dr. Angelica, I have one question for you. Does resentment, unforgiveness and trauma affect one's mental well-being?
Dr. Angelica, from the medical point of view, how would a doctor accept when a patient who has started on some treatment but discontinued and then turned to spiritual guidance and, much involvement in prayers and different spiritual activities, later on take a test for the same thing that they were taking the medication for and find that they are completely healed? How does the medical thing accept such a thing from that point?
Father Juvi, in your many years of pastoral care, I'm sure you would have come across counseling so many of the elderly sick and those having to deal with the impact of illnesses. And we come to a point, a very spiritual low, where the questions in the minds of us in our deepest sufferings, it would be, why me? Where is God? Why all this is happening only to me? to the rest. What do you say to her?